Hi, everyone. Hold on a second. Okay, sorry, guys. This is a little bit of a technical issue. So right now, I'm Dr. Samantha, the maternity mentor. Hi. I am currently live, but I cannot actually see myself, so this is a little weird. So I'm going to go ahead and get started, but if that's why I sound a little off and seem a little off, that's because I am looking at a black screen. So I'm Dr. Samantha, the maternity mentor. Welcome back for another one of our live Q&A sessions. We have them here every Monday at 9 p.m. Eastern Standard Time. This is my chance to answer questions that you guys have submitted onto the videos, as well as to answer any questions that you submit here live while we're talking. You can put those into the chat. Remember, we're on Facebook, Instagram, and Twitter for additional content. Those will be linked into the description. Please share the channel with your friends and family, and please like and subscribe to the channel. Subscribing to a channel is really, really, really important for all YouTube content creators. So I really appreciate it. For those of you guys who stay until the end, I'm going to give you a sneak peek at tomorrow's video. And one of the ways you can find out what our new videos look like is you can actually hit the notification bell and you'll be notified when those come up. So again, please feel free to put any of your questions into the chat. I'm also going to go ahead and I'm going to be looking at questions that we received onto the videos this week. So we had several really good questions, like really, really great questions this week. So I'm going to start actually with an RH factor question that we got. And so what it says is, can a woman take the RH immune globulin to prevent antibody formation? I delivered my baby 6 years ago and the baby was RH positive. So RH refers to the rhesus factor. So this is the part of your blood type that says whether you're positive or negative. Okay, so we have 4 blood types: A, B, AB, and O. And then after those, you have positive or negative. Now, when you are pregnant, your baby could have a different blood type than what you have. If you're an RH negative mom and your baby has RH positive blood, that blood mixes with your blood and your immune system can be activated to it and look at it as a foreign invader and actually try to attack the baby. You create an antibody response and then those antibodies go after the baby. What happens is this does not actually occur until your first pregnancy with an RH positive baby. To help prevent this, when we know that you are RH negative, around 28 weeks of pregnancy, we're going to go ahead and give you the RhoGAM shot. The RhoGAM shot is this shot that helps to prevent you from creating those antibodies. We will also give it to you again after you deliver if the baby is RH positive. And the way we figure that out is we test the baby's blood. Now, if you delivered years ago and you are RH negative and your baby was RH positive, you can ask your healthcare provider about giving you the RhoGAM shot. Sometimes they'll do that. Sometimes they won't. I have heard of it being given up to 6 months later. I don't know about 6 years, but it's certainly an option for you to ask for. Now, for those of you guys who do know your blood type is negative, you want to make sure that you are asking for that shot if you were to have a miscarriage. So a lot of people don't think about this, but if there's a lot of times that a woman will have a miscarriage very early on. In fact, some women won't even go to their healthcare provider. If you know that you have been pregnant and you know your blood type is negative and you've had a miscarriage at home, you should be having the RhoGAM shot. So what you want to do is contact your healthcare provider and ask them to give that to you, because this same reaction can still happen for future pregnancies. Okay, so that's really, really important with RhoGAM. And we have a video on it that you can check out some more details. Okay, hi. So, hi, Permanent. So it's been 2 days. My baby is sleeping too much during the day, but if I press, he's moving. But during the night, he's playing nicely. Is there any problem about that on 35 weeks? So this is extremely common, okay? So if you think about it, once you're getting to like your 3rd trimester, when you're walking around during the day, in essence, you're rocking the baby to sleep all day long. Okay, so actually, it's very common for a lot of moms in the third trimester to say that the baby is just sleeping most of the day. Baby does move and stuff, but sleeps a lot. And then at night, the baby's super active. And that's because when you lay down at night, you're no longer rocking the baby to sleep. This is kind of why babies like swings, just so you guys know, because the whole third trimester, this is all they get, right? So what are we looking for? We're looking to make sure baby responds, okay? So the fact that you're telling me that when you push the baby in your belly, the baby moves around, that's a good sign. You want to make sure that you are feeling the baby move somewhat every single hour, at least once an hour, and usually it's more than that. The difference is, if you guys think about it, when you're sleeping in bed at night, you move your hands, you move your legs, like you switch positions. Your baby's going to do the same thing. So you should feel little tiny movements, even if the baby's asleep, every once in a while. The other thing is, when we're doing ultrasounds for babies and we're not sure how well they're doing, one of the things that we will do is we'll go ahead, and if the baby's not moving a lot, we give mom some juice. So when you drink something like juice, which is very high in sugar, within like 15 to 20 minutes, the baby usually wakes right up because they just got a shot of sugar. So they get a lot more active. So this is a really good way also to figure out if the baby's doing okay. And then finally, if you're not sure, you want to call your healthcare provider, and they're probably going to have you do a kick count. And a kick count is kind of like what I just described. You basically sit down in a chair or a quiet place, and for an hour, you just sit there and you write down just a little mark every time the baby moves. And you should have a certain number of marks within the hour. If you have that, that's great. If the baby's still not moving great, we tell you to drink juice and try for 20 more minutes. And then if not, we tell you to come to the hospital so we can do an ultrasound. But this is actually an extremely normal pattern. Now, there's a little bit more to this for anybody who's wondering. So again, I told you, this is very normal. So at night, your baby is more active because you aren't rocking the baby to sleep. Well, guess what? The baby doesn't know what's day and what's night. And what do we all hear about? We all hear about babies who are awake all night when they're born. This is because they were awake all night when you were pregnant. So for starters, their circadian rhythm is off from ours because this is their normal sleep pattern. Sleep during the day, be up at night. Now, there is an actual physiologic reason this is so important. The human body, when making breast milk, has a hormone called prolactin. And prolactin is the milk-making hormone. It's the hormone that says, make lots of milk. And prolactin is highest at night, especially between 1 a.m. and 4 a.m. This is why when you're talking with healthcare providers and lactation consultants and they tell you, hey, you got to breastfeed at night, that's why they're telling you that, because that hormone's highest at night. Well, guess what? We need babies to eat the most at night because prolactin is high at night. Well, if your baby's circadian rhythm is completely reversed from yours because of the normal activity you have during your pregnancy, that baby who's up all night wants to eat all night. Baby eats during the high prolactin times, and you get the signal to make lots of milk. That's how we get a good breast milk supply going. This is why it is so important that you sleep during the day, because your body and your baby are primed to eat during the best hours of the day, which happens to be the middle of the night, to help you establish a good milk supply. So I hope that helped. That was a great question right there. So speaking of breast milk, we got a question. Could you please explain more on how to use breast milk after freezing, and how do I warm the milk for the baby? So I have a video on like proper supply and storage of breast milk. I also have some on formula feeding. So for those of you guys who are like formula feeding your babies, I have some on cleaning bottles and also on the types of water you should use. So check those out. So breast milk storage is extremely controversial. You're going to find a million things everywhere. I don't really think, it seems like every single year they change the storage guidelines. So the first thing you need to know is that when you pull out milk from a freezer, you cannot put it back. That's it. It's done. You have to use it. Generally speaking, we want you to use it between 24 and 48 hours. To be very honest, I usually recommend people use it within 24 hours. I mean, you've pulled it out for a reason. You need it. So just get it used up. Now, the way to heat it up, honestly, if you are planning for the next day, you can leave it on the counter for a couple hours to let like room temperature kind of start the defrost process. And then when you go to bed that night, stick it in the fridge. By the next day, it's probably going to be mostly defrosted. If you need it quicker, you can actually heat it up the same way you can defrost it, which is in warm water. Okay. So you cannot heat breast milk in a microwave. That is a no-go. It creates hot spots in it. And if you don't mix it right, you can actually burn the baby. I'm going to also tell you that I think I use a microwave all the time. I'm not anti-microwave, but I do think it would kill off some of the beneficial properties of breast milk. So I wouldn't do it. Instead, all I would do is take your bag of breast milk. It's usually in a bag. That's how we usually store it, right? And you just take it and put it in like a big cup or container that's full of warm, hot water. Just stick the bag in about a minute or two, it's going to be defrosted. It's as simple as that. If you're worried about the bag opening up in like a container like that, because some people get a little nervous, like what if I didn't seal it right or something like that, just double bag it. Just stick it in another Ziploc bag so you've got that extra protection. And that's it. A couple minutes later, it's going to be nice and warm and ready to go. If you have some time, you can put it out onto the counter and let it go to room air. You know, breast milk is good for 4 to 6 hours at room temperature. And even that's very conservative. So you could just let it go to room temperature and use it that way. So I hope that helped. For those of you who are joining us, please feel free to put any questions into the chat. And just so you know, I am having a technical issue where I cannot see myself. So if I look a little strange, that's why, because I cannot see anything but a black screen. I just know that you guys can see me. I get a lot of questions about bleeding. And I got one this week, and it was a very, very good question. I think it's a very, this was very scary what happened, and I think it can happen to a lot of people. So I thought it was a good one. I'm 7 weeks pregnant. My little son bumped the top of my belly, and then the next day I started bleeding. The following day it started again. Not heavy bleeding, but I have a lump or a knot in my belly where he hit my stomach, and it has started to hurt. I'm nervous because I've had 3 live pregnancies, and this will be my 4th and my first time bleeding. So that sounds super scary. And, hopefully everything's going well with this viewer. So for starters, when you have bleeding, you need to make sure that you're going and getting checked out. So you want to make sure that you're either getting an ultrasound or you're going to get checked by your doctor or go to the hospital to get checked out. In this particular case, this is basically trauma, okay? I use this with quotation marks because in this particular case, a lot of you are going to have small children or be around small children, and getting your belly bumped by a small child, generally speaking, is not a big deal, okay? It's very, like, it happens all the time. Little kids don't always know their body in space. However, clearly, this bump was big enough to cause something. I would tell you that something like this, I would not call it coincidental. I suspect whatever the bump was did cause something. Now, what could it have caused? One of the most common causes of bleeding during pregnancy is something called a subchorionic hemorrhage. So a subchorionic hemorrhage is you have your placenta and it's attached to the uterine wall. And this is all blood vessels and this is all blood vessels. So occasionally you'll get this pooling of blood underneath. Imagine it like a bruise. You know how you get the bruises and it's like basically a broken blood vessels under the skin. That's what turns it purple. Well, you get this subchorionic hemorrhage. It's basically a pooling of blood where some blood vessels broke. Sometimes that will actually seep out and you get this bleeding from the subchorionic hemorrhage where you had that pooling of blood. That very well could be the case here, okay? Now, another thing that could have happened is a placental abruption. So placental abruptions at their worst form, are medical emergencies that if we do not do an emergency C-section within minutes, both mom and baby could die. They're a very big deal. A placental abruption is the placenta comes off the side of the uterine wall. Okay, very dangerous. However, you can have partial placental abruptions. So this is your whole placenta that's attached and only a tiny piece of it comes off, okay? Now, I can't even demonstrate how tiny a placental abruption could be. And that tiny little piece that comes off, you're going to have some bleeding, and then it's going to clot off, and then the placenta continues to work. Baby's fine, mom's fine. A placental abruption very commonly can come as a result of trauma, which is why that's what this could be as well. Now, it also comes with abdominal pain. That's why this sounds more like a placental abruption. Now, clearly, she's okay right now if her note is accurate, but a placental abruption can be a medical emergency, which means if you're not sure, you need to go get checked out. How do we diagnose a subchorionic hemorrhage from a placental abruption? We do that with an ultrasound, and that can be done at a hospital. Now, if she has a placental abruption, they may recommend stuff like bed rest. If you have a subchorionic hemorrhage, they usually will resolve on their own, and you don't need any kind of special intervention. So that's why it's so important you guys get checked out if you have any kind of bleeding. All right. So I got a question on drying up breast milk, or actually came on the drying up breast milk video. Now, this one's interesting. My aunt gave birth to a baby girl 12 years ago, but she still has heavy pain in her chest. If she doesn't express the breast, she leaks. And when she does, she only gets relief for a few minutes. She's been checked by doctors, but has no use. Please, what could be going on with her? She can't wear tight dresses or fitness clothes. She has to wear very loose dresses. Okay. When you've had a baby and you're trying to dry up your milk supply, this can be extremely distressing, especially if it won't stop. Breast milk production, unfortunately, can continue for a lot of reasons. For those of you who didn't know, you can actually start producing breast milk because you're stressed. So that same hormone I was talking about, prolactin, when you're really stressed, that hormone will actually rise in your body. And then sometimes you'll start organically making breast milk. And this can actually happen to men too. There is also a certain kind of tumor called a prolactinoma, which happens on the pituitary gland, which is inside your brain. And a prolactinoma is not cancer, but it is a little benign tumor that has to be removed with surgery, or else you'll continue to produce too much prolactin and you'll end up with making breast milk. And that could be what's happening with this person. The only way to diagnose a prolactinoma is to get an MRI of the brain, which is just a special picture to see what's going on. And then we make the determination from there if we need to do some kind of surgery. Now, sometimes there's no prolactinoma. We can't really find a cause, and so we chalk it up to stress, okay? When stress is the cause, now we have to go to some of the solutions to dry up milk. And you guys know if you didn't know, I have a video on herbs to help dry up your milk supply. I have the drying up milk supply, which has some other solutions. In this case, if a prolactinoma was ruled out, I would recommend that she ask, and I can't believe I'm saying this, about a medication called cabergoline. So cabergoline is a medication that I really don't like at all. And so I do not recommend it for a postpartum mom who's trying to dry up her milk supply. The reason for it is cabergoline is really, really good at drying up milk, like amazingly good. You take it for about 10 to 14 days and your milk is gone. The other thing is it makes you feel great. It increases some of the neurotransmitters that actually lift your mood. So you feel so happy and wonderful and just really good. But the problem is, after the 10 days of taking the cabergoline, you have to stop. And when you do, the rebound depression is debilitating. And when you're postpartum, that's just horrible. So if you are a postpartum mom, I absolutely hate using cabergoline. I do not recommend it. I try to get everybody not to take it. But other than that, I think cabergoline might be effective for somebody who's having longer term issues with milk production and trying to just get that stopped once and for all. So that's what I'd say about that. So for those of you who are joining me, please feel free to put your questions into the chat. Right now, I am answering some of the questions that we've had on some of the videos this week. So I had a question on donor breast milk. So what if the donor milk is from someone who has HIV or hepatitis B? So this is a great question to talk about donor breast milk. I think donor breast milk is one of the most amazing things out there, okay? So I am a lactation consultant and I am very pro formula. So anybody who's choosing to formula feed or is currently formula feeding, rock on, you're doing amazing. There was one time in my career as a lactation consultant where I try to really work with a mom to make sure we try to make her as successful as possible for producing and providing breast milk, and that is for a micropreemie. So a micropreemie is basically a baby who's born between like 22 and 28 weeks of gestation, okay? So these are these little tiny babies. They're sometimes like this small. They can be as little as under a pound. And these babies, their gut is not developed. I mean, so much development is still going on at that time. And so when they're delivered, like breast milk is like a medicine for them. It is not food. It is medicine because all those things you read about are so, so important for making a baby healthy and strong who's been born prematurely. Now, the other thing you guys need to know is that one of the reasons why you hear a lot about how breast milk is better for a baby, the babies grow better, the babies get all these benefits, blah, 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 is because our breast milk is human milk for a human baby. When we drink formula, which is cow's milk, generally speaking, you're talking about cow's milk, cow, another species, for a human baby. So the species is not the same. That is why breast milk has some of the advantages it does. Okay? Now, in addition, when a mother provides breast milk to her genetically born child, like her genetic child, that breast milk will actually be specialized to her baby. Okay? But not everybody can provide breast milk for a variety of reasons. That is not their fault, okay? Like there's medical reasons and all sorts of other stuff, right? So donor breast milk comes in to take the place so we can provide human milk to a human baby who's medically fragile. When we provide other milk, there's a risk of something called necrotizing enterocolitis. This is basically a life-threatening infection of the intestines, and babies oftentimes have to have surgery to save their lives. Breast milk can help prevent this. That's why it's a medicine. So many neonatal intensive care units, NICUs, will actually purchase breast milk in order to provide it to these micropreemies to help save their lives. When we're getting to the question of infectious disease, like hepatitis B or HIV, that is an extremely valid concern. Like that is not a joke, and it's definitely something that should be asked. You cannot buy breast milk online. You can't do that. And it's done. Don't do that. You have to make sure you're getting your donor breast milk from a milk bank that has been certified. So Hmbana, Hmbana, is one of the organizations in this country that helps put together milk banks and monitor them and stuff like that. Your country, if you're from a different country, probably has something like that, but you need to be going through a certified milk bank that your country's health department is aware of. Because these milk banks that are certified, they go through a very strict, stringent process of screening donors, screening milk, pasteurizing the milk, the whole 9 yards. In fact, the milk banks, when the COVID-19 pandemic came out, they started figuring out almost immediately how to test breast milk for COVID-19. So this is some of the things that these certified places do, is they're looking and they're ahead of the game on what to test for next. You know, you mentioned HIV and hepatitis B. This milk is screened for a lot more. Some places screen for Zika. Some places screen for a lot of other things. So it has to come from a milk bank. If it comes from a milk bank, it should be screened for those, and therefore it should be safe. Now, the other thing I'd be telling you is if you're a private individual who is trying to purchase breast milk for your baby and you are going through a milk bank, you know, if you know that your local hospital is also purchasing milk from that same milk bank, listen, your local hospital is not trying to lose their license over some uncertified, unsafe source of milk. They're going to be getting the breast milk from a very legitimate provider. And that's one way, I think, also to gauge safety. So that was a really good question. For those of you who are joining us, hi, I am Dr. Samantha, the maternity mentor. Here we're answering some of your questions live that you guys have given me over the course of the week on the videos. You can also put questions into the chat. For those of you who stay on until the end, I'm going to give you a sneak peek at tomorrow's video that's coming out. So please keep it up. And if I look weird, guys, I'm looking at a black screen. Today I'm having some kind of tech issue where I can't see myself. So that's why I might look weird or not. Okay, so I'm going to go on. I have a question on second trimester bleeding. So I'm 14 weeks pregnant and I had heavy bleeding at 9 weeks. The doctor gave me an injection of the medicine and the bleeding stopped. But now I have brown discharge, but the baby's heartbeat is normal and my os is closed. So that is pretty normal. So I have a video, guys, on the colors of bleeding, which I think is very helpful for a question like this. So when you have the colors, bright red bleeding is our most concerning because that usually means that there is actually active bleeding going on. Pink is usually bleeding at starting or stopping, or it's like spotting. And then brown is usually old blood. So if you had bright red bleeding and now it's been resolved, brown like discharge might follow. So that could be very normal. So the biggest thing you look for is to make sure that everything else is going good. Heartbeat normal, that's a good sign. Cervical os, that's the opening for the cervix on the inside being closed. That's exactly what we want it to be. So all of that sounds fine, and seeing a little bit of brown discharge could be normal. The biggest thing with this question that is concerning is the length of time. So the initial bleeding was at 9 weeks. She is now 14 weeks pregnant. That's a long time between bleeding. So what I would tell you is you need to contact your healthcare provider. They may want to do another ultrasound and just see if anything else is going on. Maybe you had a subchorionic hemorrhage that caused that bleeding and now it's bleeding again. Maybe the placenta is really close to the cervix. Who knows? But you want to make sure that you go ahead and get that checked out. And the best way to do that is to get an ultrasound. Okay. So we had a question on, we had several questions on yeast, but so I'm going to go for starters with the question that's about a breast yeast infection. So she said, I'm from Pakistan and I'm worried about my breast health. I had breast cysts during breastfeeding and now I stopped breastfeeding 2 weeks ago. I have a cyst in my right breast and there's a lot of itching and an infection on my nipples with tiny bumps. The bumps vanished, and now that is a white layer, and that is worrying me. Okay, so this does not sound like a yeast breast infection. So yeast breast infections, generally speaking, are your breasts can be itchy. They can have a little bit of redness or shine to them. You may see some flakiness on the nipple, but the biggest thing is a a deep shooting pain, deep into the chest wall pain. It is sharp, it is shooting, it is burning, it is horrible. That is the classic sign of a yeast infection in the breast. You may also have some itchiness and some other things, but that's your classic sign. And a lot of women will report a lot of pain when they are breastfeeding, okay? So that is your classic sign. Cysts sound to me like a plugged duct, which is actually a sign of mastitis. And plugged ducts, oftentimes, if the milk is like curdling or congealing and coming out towards the nipple, you'll see a little bit of white on the end of the nipple. I would definitely have this checked out. At this point in time, you need to have your healthcare provider take a look. Those cysts need to be ultrasound. You need to have an ultrasound done to see what's going on there, because those could become massively infected and actually become abscesses. And abscesses are infected areas of like pus, and they sometimes have to go in and pull that pus out with a needle. You might need antibiotics, you might need other things. But at this point in time, I would agree with you. I would be worried as well, but you need to get checked out by a healthcare provider. If it is yeast, they need to treat you with yeast medications. If it's like mastitis or something like that, they need to give you antibiotics. We had a question on the Tdap vaccine. It says there's a lack of vaccine supply in the Philippines. Is Tdap available privately? So for those of you guys who don't know about the Tdap vaccine is for tetanus, diphtheria, and pertussis. This is a vaccine that mom gets during pregnancy, and family members are recommended to get before the baby is born. The reason why we recommend it is for the pertussis part. So pertussis is whooping cough. Now, a lot of people don't realize, but whooping cough is very common. It's around everywhere. I'm from South Florida, and whooping cough is actually endemic. That means it's a part of our population in Miami. And so whooping cough, when an adult gets it, is no big deal. In fact, most adults that get whooping cough won't even know that they have whooping cough, because for them, it's just a cold and they don't even get a cough with it. So weird, right? And some people won't even have any symptoms. But babies who get whooping cough can die. And here in Miami-Dade, we've had babies die from whooping cough infection. And your baby isn't eligible to get the pertussis vaccine right away. So as a result, your baby remains unprotected for up to 6 months. But as a pregnant woman, when we get a vaccine, we make antibodies, and those antibodies will cross the placenta into the baby, and the baby gets protection through mom's antibodies, okay? So that means when your baby is born, if your baby gets exposed to whooping cough, they won't develop the infection, which is great. The reason why we also recommend family members get vaccinated for pertussis is so that they don't run the risk of bringing it home, okay? Because your baby's getting passive immunity when they get the antibodies from mom, and therefore it's not quite as robust as making their own antibodies. So you want to make sure as many people that are exposed to the baby as possible are actually getting the Tdap vaccine. I can tell you, when I was working in the hospital and we were working with newborns, they heavily encouraged us to all get the Tdap vaccine, so that we would not bring pertussis into the hospital with the babies that we were working with. So I've always gotten the Tdap vaccine. And it's really a great vaccine. It's very well tolerated, and it just helps protect your baby and other babies that you might be around. We had a couple questions on yeast infections, vaginal yeast infections. So the first one said, I'm 15 weeks pregnant. I had a yeast infection. This past week, my doctor prescribed CanSoft CL suppositories for 3 days at night. I completed the course 3 days ago, but the yeast infection is not cured. What can I do? My sugar levels are controlled. So for those of you guys who don't know, CanSoft, which is not used where I'm at, is basically a combination of clotrimazole and clindamycin. Clindamycin is an antibiotic. Clotrimazole is a yeast infection treatment, like an antifungal. That is safe for use during pregnancy. So that's a really good option. Couple of things. You have to check with your healthcare provider before you use any yeast infection treatments that you find over the counter. Generally speaking, they're actually all safe for pregnancy. However, they come in different versions. For example, this person mentioned that she was using a suppository. Depending on which version you use, there's a different method of like administering it, giving you giving you that medication, right? So if your doctor doesn't want you to say, put your fingers in your vagina because you're at risk for infection, then they may not want you to use some of those. Now, there's a lot of issues with yeast that is treatment resistant. Just like we're having a lot of bacteria that's bacterial, like antibiotic resistant, that's happening with viruses and yeast as well. So sometimes the over-the-counter stuff is just not going to work. So you may need an oral anti-yeast medication like diflucan. Now, if any of you guys are on here and start Googling diflucan, you're going to see some very scary stuff about it, okay? Diflucan at high doses can cause birth defects, to be very, very flat out honest. However, at low doses, it is safe for pregnancy and it is one of the most effective treatments for yeast infection. And yeast infections, if left untreated, are a cause of miscarriage, preterm birth, and stillbirth. So yeast infections are a big deal like any other infection during pregnancy, and you want to make sure you're getting them taken care of. So you need to call your doctor and ask if they want to do a longer course of like a suppository or if they want to give you the diflucan. The other thing is, for those of you guys who are wondering, she mentions her sugar. She says, my sugar levels are well controlled. Why did she mention that? Because sugar is what feeds yeast. So I don't know if you guys bake. I bake. For any of you guys who have baked, yeast rolls are like one of my favorite things. They are also really hard to make. And the reason why is when you make a yeast roll, you have to use yeast cultures and you add them to like the flour and stuff, and then you have to let them grow. So in order for them to grow, you have to feed them. And when you're making this bread, what do you feed them with? Sugar. So when you mix sugar in, you're actually feeding that yeast, and that's what causes it to like puff up and grow. So when she's mentioning sugar, it's because she knows that yeast in the vagina grows with sugar. So if you guys have diabetes and it's not well controlled, that can actually increase your risk for getting yeast infections. Now, the next question said, I'm 35 weeks pregnant and this is my first pregnancy. I was prescribed 3 clomitrosol pessaries. Those are basically suppositories, 500 milligrams to insert into the vagina for 3 alternative nights, as well as to take 1 500 milligram azithromycin every 24 hours for 5 days. Azithromycin is an antibiotic to treat infection, like a bacterial infection. My question is it safe to take these? Is it safe to take these 2 medications at 35 weeks pregnant? My discharge is greenish cottage cheese. Okay, so azithromycin, safe for use during the pregnancy at 35 weeks. Clotrimazole, safe for use. Absolutely. Green discharge, holy smokes, go to the emergency room now. Okay, so you can get green discharge very early in your pregnancy, and I have some videos on STDs that you can take a look at. But like there's a couple STD infections that will cause a green discharge early on. Now, if you have a green discharge that smells bad when you're in your first trimester, you want to go ahead and get that swabbed, and it's most likely going to be like bacterial vaginosis or something like that, which is a bacterial infection of the vagina, and they're going to give you an antibiotic, and that's going to take care of it, and you're going to be good to go. But when you have green discharge at 35 weeks pregnant, so late into the pregnancy, the first thing I think of is meconium. So what is meconium? Meconium is the first poop that your baby will have when your baby delivers. So that poop that comes out is usually black or green. And if it's black in the beginning, it turns to this like green, and then it goes to the normal color that we're all used to. But that meconium is something that's inside your baby and is supposed to be inside your baby at birth. When a baby passes meconium inside the belly, inside the amniotic sac, that is a sign of distress. This is a sign that a baby is not doing well. There's a variety of reasons why it can happen, but it is definitely not something we want to see. It's not necessarily a medical emergency, but is 100% something that needs to be looked at like immediately, because babies don't pass meconium for no reason. Okay. Then on top of it, if the baby swallows that meconium, that poop, it puts them at risk for pneumonia and other illnesses. So this is a baby that if it is born, you want to make sure it's born at a place that has respiratory support and possibly even a NICU there to help take care of the baby if needed. You also want to have trained personnel who know how to resuscitate a baby when it's a meconium delivery. It used to be that what we would do is we'd suck out the baby's like trachea, which is the tube that goes down the throat into the lungs, and we'd suck out the mouth. That is now not always the appropriate care. Okay. And so it's important that you're at a facility that knows how to take care of this, knows how to assess it, etc. If you have green discharge and you're in your third trimester, you need to go to the hospital to get checked out. If that is meconium, that also means that your water has broken. So the amniotic sac that the baby is in, it's like a bubble or a balloon full of water. And as long as it's intact, you are not going to see any fluid leaking, and you would not be able to see meconium. That would not be something that you could see. Now, a lot of people think when their water breaks, it's going to be this big, like a gush, like an explosion. And instead, what a lot of people don't know is you can have little tiny leaks that you don't even realize you have. This is why we tell you guys, if you're not sure whether you peed on yourself or it's amniotic fluid, go to the hospital for us to check you out. So you got your uterus, and your baby sits inside this uterus in that ball, right? Well, at the bottom of the uterus is the cervix. Now, if your balloon, right, your baby's floating in this balloon. If the water breaks, the balloon is going to start to deflate. And when it deflates, the baby's head can sit on top of the cervix, right? And when that happens, not much fluid can leak out through the cervix. So your balloon, if it gets a little teeny tiny tear right up here at the top, then you would not necessarily know that your water is broken, because you might only get little drips here and there. And these drips might be so little that it's basically only happening when you like go to the bathroom. So it's hard to know for sure. But if your water was to break prematurely and you did not know, and it's left like that for a couple of days, you can develop infection. And one sign of infection is a baby that's not doing well. And one sign of a baby that's not doing well is meconium. And so eventually some of that meconium may start seeping through, and then that's where you get the green discharge. So for any of you guys who are, again, having any kind of discharge, you really need to get it checked out. But definitely that is something I'd be worried about in the third trimester. For those of you who are joining me, hi, Samantha, the maternity mentor. Please feel free to put some of your questions into the chat. I am hoping the chat is working. I did get one question in there, but I am having some technical difficulties. I cannot see myself, so I don't know for sure. But, you know, I'm here, and I'm going to keep answering some of your questions from the videos this week. So I got a question on the preeclampsia video. I'm pregnant, and this is my 7th pregnancy. I developed preeclampsia with my 6th pregnancy in the last 2 weeks. I'm 22 weeks pregnant now, and my feet and hands keep swelling up. Is this preeclampsia again? Technically, you're right on the edge of when you can be diagnosed, but I'm going to probably say yes. Every pregnancy that you have increases your risk of developing preeclampsia. Swelling of the hands and feet, very common and classic. The biggest thing is they would just have to monitor you. At 22 weeks pregnant, they're not going to deliver you for preeclampsia unless your life is in danger. So they're going to try to keep you pregnant as long as they can. It's very important that you're being assessed regularly. So you're going to want to make sure that they're checking your urine for protein, that they're checking your liver enzymes and all this other stuff. So that's like one of the most important things that I can tell you, okay? Now, if you had preeclampsia, hopefully they are sending you to a maternal fetal medicine physician. Maternal fetal medicine physicians are the high-risk doctors that specialize in taking care of women who have some kind of complication going on. Preeclampsia is one of those conditions. So you want to make sure you're with a maternal fetal medicine doctor who's keeping track of your blood pressures and your liver enzymes and all this other stuff, so they can make sure they best support you and keep you pregnant for as long as possible. Also, I have a video on taking baby aspirin during pregnancy. Please check that out because you should be taking baby aspirin during your pregnancy. Hey, Nancy, what's the best way to conceive? What's the best position, to conceive right away? There is no best position. This is a complicated question. Okay, if you have, which is rare, certain shaped uteruses, like there's a bicornate that's like a heart shape, very rare, then sometimes certain positions are best. Other than that, there is no position that is best. That's just an old wives' tale. The biggest thing that would be helpful for anybody who's trying to conceive is to use an ovulation kit to make sure you know you're ovulating for when you go ahead and you get pregnant. Now, one of the things that people will tell you to do, which there is a certain amount of evidence that this can help, is after you've had sex, you lay back and you put a pillow underneath your hips. So you're tilting your pelvis so that basically gravity is working to keep the sperm inside of you and keep the sperm heading towards the cervix to get up through the cervix. Okay, there is some evidence for that. When you talk about that, if you have sex where when your partner finally has an orgasm and ejaculates his sperm into the vagina, if you're missionary or on your back, then you don't have to move positions to then put the pillow. You're already on your back, so you can just have your partner actually slide the pillow underneath your hips, and then you're not moving around, which might kind of work against that position. So that is one thing that people say that can help. And there is some evidence to say that it might. But other than that, no, basically knowing that you're ovulating is the best thing. Okay, tummy time. I didn't have a question. I had a comment from one of my viewers, Gabriella, who said, my baby doesn't like tummy time or being on her side. She starts crying within 30 seconds. So a lot of babies don't like tummy time. This is extremely common, and tummy time is something they have to get used to. Depending on your baby, the other thing is you may or may not need to have the baby checked out for torticollis. Torticollis sounds super scary, right? It's actually not that big of a deal. Torticollis is basically a stiff neck. So you guys know, like when you sleep wrong and you get that like thing with your neck and it's like you can't turn your head and stuff, that's basically torticollis. Okay, so your baby is sometimes born where the neck is super tight. Okay, this whole area is tight. And it's probably because of their position in your belly. For the last couple of weeks, they were probably stuck in some weird position. And so it makes one side or the other super tight. One of the ways that we notice torticollis is a baby who's laying on their back will always like favor one side. And you can like move their head and then they'll go right back to that side. Okay. And sometimes when you try to move their head, it's super tight and they don't want to move it. That's an example of how we kind of see torticollis. Torticollis can affect a baby's ability to eat. And this is not just breastfeeding. This is also bottle feeding, which could be formula, right? And it can also affect their ability to participate in tummy time. So you may find that babies who don't like tummy time, it's because they're a little tight. Now, what do you do if your baby has torticollis? Well, first you need to make sure they have torticollis, and then you ask your pediatrician to send you to a physical therapist who teaches you how to do some stretching exercises for the baby. You do not do stretching exercises on your own. You want a trained professional who has laid their hands on your baby to teach you how to do it. However, it's usually very easy, very mild. They'll teach you on the first session, and then you'll go back in like a month and they check the baby again. It's really not that big of a deal. For babies, tummy time helps to loosen the muscles up. So if your baby's a little tight, that also may make it a little uncomfortable for them. They don't have torticollis. I mean, you can just be a little tight, right? How many of us get stressed and we get like a muscle ache or something, right? But so laying on the stomach kind of forces them to move around. They're also building muscle. Okay, so if you think about it, like if I make you start doing sit-ups right now and you just have to keep doing sit-ups, I mean, 30 seconds of sit-ups for some of us who aren't that in shape is not going to feel great, right? And by a minute, many of us probably want to cry. So think about that from your baby's perspective. Your baby's building a whole bunch of muscles with tummy time, and therefore it might actually hurt a little bit. Like it might be sore. Babies love to be held. So, who's going to want to build muscle when they've got warm, squishy mom or dad right next to them? So that's why you got to make it fun. So you got to try to use some of the skills like the singing songs and being silly and lots of bright colors. And then you just don't press it. Now, the other thing you guys can do, if you watch the video, one of the things I say is for newborns, you start and you can kind of lay them on your belly here. Well, guess what? You could lay down on the ground, flat on your back, and put the baby on your belly. That's tummy time. Tummy time does not have to be exactly like what I described. As long as you are attending to your baby and you are safely monitoring the baby, make it your own. Maybe that's how you get tummy time started. I'm finishing up. I've got a couple more questions, and then I'm going to give you guys a sneak peek at tomorrow's video. My next two questions came in on my depression video, and I really find these questions to be some of the most important that I answer. So for those of you guys who don't know, I am now in psychiatry. That's my primary practice now. I specialize in medicating women who are pregnant and postpartum, including women who are breastfeeding, because it's just an area that a lot of people are not comfortable with. And so I feel it's very important to talk openly about using medications during pregnancy. So the first one I had is I've tried many antidepressants, and the only one that has helped me so far is Luvox, fluvoxamine, for OCD. Is this medication safe? OCD is an anxiety disorder that is well known for being treated with 3 medications: Luvox, Prozac, and Zoloft. For a lot of pregnant women, they're very fortunate. Zoloft is the #1 medication used for depression and anxiety during pregnancy, and it happens to be pretty good with OCD. However, Luvox, hands and away, is the best one for all of the antidepressants and anti-anxiety drugs for OCD. It's very, very effective. Now, what do we know about Luvox? So for those of you guys who don't know, medications cannot have studies run on them when you are pregnant or breastfeeding. It is not ethical. It is not safe. So we have to take a whole bunch of data from animal studies, molecule size, fat solubility, a whole bunch of different stuff, half-life of the medication, in order to create a safety profile. So for Luvox, Luvox is a medication that we look at risks versus benefits. So you guys are aware, untreated anxiety and depression can cause miscarriage. Untreated anxiety and depression can lead to preterm birth, stillbirth. It can lead to all sorts of complications for the baby. So it's very important to treat. And most of the time, well-treated anxiety and depression is far less dangerous than untreated anxiety and depression during pregnancy. Now, when we come to Luvox, what we know is that when rats were given doses of Luvox way higher than a human being, but were given it, there were some birth effects noted, specifically some eye birth effects, okay? However, rabbits who were given the same high doses of Luvox showed no signs of birth effects. From what we can see from the data right now, Luvox is probably safe during your pregnancy. It requires a discussion with your healthcare provider. One very valid option for a mom who is really benefiting from Luvox, but also wants to be extremely safe during her pregnancy and really just doesn't sit right for her to take it, you can actually potentially work with a healthcare provider to discontinue the Luvox during your first trimester and then restart in your second trimester. Because first trimester is where most of the organ development happens. Now, the only other thing we know about Luvox is that there is a high potential for withdrawal syndrome. So withdrawal syndrome, any of the SSRIs, they boost serotonin, right? So serotonin is a neurotransmitter, so a chemical in the brain that helps with your mood. It makes you feel less depressed and less anxious. It's really great. You feel good with serotonin. And so like Luvox, Prozac, Zoloft, Lexapro, we are giving you serotonin. So when we give you these medications while you're pregnant, your baby is also getting serotonin. So your baby feels really good. Like your baby is like happy like you are. But then when you deliver and that placenta detaches, your baby goes cold turkey. And so if any of you guys have ever heard, you're not supposed to stop your medications without talking to your healthcare provider because you can get like a withdrawal. Now, what does the withdrawal feel like? Headaches, sweatiness, stuffy nose, irritability. In babies, they can shake, they can have a high-pitched cry, they might not eat well. They don't feel good. It usually lasts for 5 to 10 days, and then the baby's better. And the best recommendation is that you feed the baby, you give the baby a pacifier, you hold the baby a lot, all that good stuff, and the baby should get through it. When we have a medication that we are worried about a withdrawal syndrome like this, one of the things that you can work with your healthcare provider to do is to potentially drop your dose towards the end of your pregnancy and then increase it back up after delivery. And that sometimes will help the baby out. So that's just one of the things. But generally speaking, Luvox can be used during pregnancy. Now, I'm 11 weeks pregnant and I'm taking Deprenex 5 and Clozex Plus. Is it safe during pregnancy? I'm worried it will harm my baby. So to be clear, Deprenex and Clonex are not Clozex are not medications used in the United States. However, I looked these medications up so I know the base ingredient and I'm going to give you a general idea. So the Deprenex, the base ingredient is Lexapro. Lexapro is an SSRI, serotonin selective reuptake inhibitor used for depression and anxiety. Yes, generally speaking, that is well tolerated for the baby and can be used. Clozex is Klonopin plus propranolol. Propranolol is a beta blocker. This is a blood pressure medication that is designed to lower heart rate and lower blood pressure to help calm anxiety symptoms down. It is safe for use during pregnancy. And in fact, if you have like a preeclampsia or something like that, we'll actually give you propranolol's cousin labetalol to help with that. The other part, Klonopin, is not safe for pregnancy. You should not be using this at all. It is a benzodiazepine. Benzodiazepines are not good for the developing baby brain. They're highly addictive. They are a controlled substance. And if you are taking a lot of that when you deliver, your baby is at risk for seizures. So your baby is at risk for seizures for any of the benzodiazepines, just so you know. So that's Xanax, that's lorazepam, Valium. None of these drugs are good for the baby at all. Every once in a while, like if you had to have an MRI during your pregnancy and you're really scared and you need to take a Klonopin, absolutely, that's fine, but not for a regular use. That is not something I would recommend. It's not something I would prescribe. But you can't just stop this medication either. So if any of you guys are taking any of the benzodiazepines, if you stop them without tapering off, if you've been using them pretty regularly and you don't taper off, you can have a seizure. Okay? And so this is why it's so important for anybody who's taking a medication, don't just stop your medication. You need to understand what's going on so that you can do it safely. The last thing I had before I'm going to give you a sneak peek at tomorrow's video was a comment on my fear of pregnancy video. And it said, wow, it has a name. I feel less alone. I thought I was less of a woman for being so scared. I have all of these fears, including a partner who won't be there for me. And that freaks me out. So I have a video on fear of pregnancy, and this is a topic that has been starting to be talked about more and more. And I always like to bring these comments to life because I really feel that it's very important that we support everyone. Not everyone wants to be pregnant. Not everyone wants this to be a part of their journey. And it's really scary for somebody who's afraid to even say this out loud because we've created this idea that everybody wants to have a kid and not everybody does. And not everybody wants to be pregnant. More and more people are choosing to have their babies other ways. And so if you know somebody who is afraid to be pregnant, don't just say, oh, you'll get over it. Oh, it'll be better. Oh, instead, acknowledge their feelings, acknowledge their fears. Don't necessarily give in to them. Just say, how can I help you? I understand. It's okay to be afraid, and one of the things that I encourage women who are afraid, but they are also on the fence. They're really not trying to give up on that dream, but they're trying to figure out how to manage it. I tell them, try to get into counseling. Counseling can be very beneficial for talking through some of those fears. And for example, in my line of work, like I told you guys, I'm in psychiatry. So I get a lot of people who are anxious and depressed and stuff, right? I have so many pregnant clients that I see that don't take any medication. I see them every month. They come into my office and we talk, and half the time they just want me to answer questions. They have all these fears and they're like, okay, but what if this happens? And what if that happens? And so for somebody who hasn't gotten pregnant yet, if you know what some of those fears are, you may be able to educate yourself out of those fears. One of the things that people are really afraid of is C-sections, right? And so I have 4 videos on C-sections. I have a video of what it looks like in the operating room, what it looks like after, what it looks like when they're prepping you. Because there's so much unknown with a C-section, and just knowing what the room's going to look like is so helpful in so many ways. So somebody who's worried about that, if they can get information, if they can ask solid questions, it makes everything a little less scary. And so that's why I tell you, if you guys do have fear, or if somebody has fear, encourage them to go ahead and get counseling. So thank you so much, everybody, for getting here to the end. For those of you who stuck around, I'm going to give you a sneak peek at tomorrow's video. And tomorrow's video is on vasospasm, also sometimes known as Raynaud syndrome of the breast. This is an extremely painful condition that can significantly impair a breastfeeding relationship, and it is something everybody should know about. So I hope you like tomorrow's video. My name is Dr. Samantha. I am the maternity mentor. We are here every Monday at 9 p.m. Eastern Standard Time to answer your questions live, as well as answer questions that you put onto the videos. Please put your questions on the videos. I love to see them. I answer them. I am the person who's writing back. We love to get that data out for you. We take your suggestions. We will always try to put the video content out that you want to see. For those of you who don't know, we are now a part of the YouTube Health platform. This is an area of YouTube where YouTube went ahead and they vetted the providers to make sure we are legitimate healthcare providers. So they figured me out, okay? So I am a real life doctor. I practice as a nurse practitioner, and the content that you are getting is real. Please follow us over on Facebook, Instagram, and Twitter. Like the videos, subscribe to my channel. Please subscribe. This is so important as a content creator, and I really appreciate it. So please, please subscribe. Hit the notification bell so you can get notified when my new videos come out. I really appreciate all of your patience with my technical issues because I still can't see myself. So hopefully I looked good tonight. Thank you so much for joining me. I am Dr. Samantha, the maternity mentor. Bye for now.